Are you struggling to heal your diastasis? Notice you have a bread loaf look to your abs? Or maybe when you breathe, it all goes straight out into your belly. Loaded thoracic rotation is often a missed component when it comes to improving a diastasis and core strengthening in general. Half kneeling rotations are a great way to help work on oblique strength in the transverse plane. They work on one side external obliques with the opposite side internal obliques to create tension across the midline while creating length in the opposing diagonal. However, they can be challenging, whether it's due to having a hard time connecting with your core instead of driving the movement from your back, or because of having limited thoracic rotation or back body tightness that affects the ability to engage your abs. Passive mid-back mobility work such as open books are great, but I'm all about ways to get multiple bangs for your buck. So come join me as we explore how to use load and gravity to improve your mid-back rotation ability and create a dynamic core. Thoracic rotation has so many systemic benefits to the body. Good thoracic mobility helps improve the core connection across the midline to help with weight transfer from one side of our body to the other. This helps unload the lumbar spine and supports the shoulders and the hips. It also helps to release the posterior diaphragm and decrease lateral ab stiffness through the eccentric loading that can help with breathing mechanics and minimize erectus dominant pattern to help a diastasis heal. From a nerve perspective, the nerves that innervate your core come from this thoracic spine. It is also the location of our autonomic nervous system. So improving mobility there will improve our breathing and bracing strategies from a multi-tiered front. So let's hop down on the ground to explore 2 ways to work your abs in the transverse plane to improve posture, breathing, thoracic mobility, and core strength. There are 2 ways that we can work thoracic rotation in a supine position. We can either work on rotating the thoracic spine on a set pelvis or rotating the pelvis on a set thoracic spine and rib cage. So first we're going to explore rotating the rib cage and thoracic spine on a set pelvis. What we're going to do here is we're going to lay on a side and we're going to make sure that knees are up in line with the hips. We can add a block between the knees to start to help create a little bit more stability in that pelvis. And the whole time we go to do this, we're only going as far as we can that top knee doesn't slide back. If the top knee slides back, then you're not isolating the movement in your thoracic spine. You can always put a little pillow or something underneath your head here as well if it feels straining in your neck. So we're going to take our weight and we're going to have this bottom hand on our top leg to give more support there as well. Squeeze that top knee down. Now what we're going to do is we're going to bend our elbow and we're going to do a chest press, but we're going to use that scapula pulling back to help turn our chest to the left and feel length in our chest wall as well as in our abs here. We're going to get to that back position and then you're going to press up and through and come back out. So we're slowly rotating to come down, making sure that elbow's bending, chest wall is sliding back, and then pressing to come up and through. So in the end, you should feel some nice movement in your shoulder blades as well as your abs working to be able to control the movement coming down and pull yourself coming back out. So as I rotate there to the left, I should feel my left external obliques lengthening. And then as I push through and come back out, I'm thinking of those external obliques pulling me back out of the movement. The whole time my lower abs are working to help stabilize my pelvis and making sure that I don't tip forward into an anterior pelvic tilt. For an increased challenge, you can ditch the block between your knees and the handhold and use just your ab muscles to hold everything in place while you dynamically move through your upper body. Now, ideally in this position of laying down, either in this move or the next move, it should feel a little bit easier to get that rotation without arching our back and flaring our ribs because gravity is kind of pushing down on us. However, we want to make sure that as we're doing that rotation, that we aren't getting that extra range by flaring, but we're thinking about our rib cage rotating around and sinking back as we come down. And then when we're coming out of it, that we're also not flaring, but feeling that reach through and hugging your rib cage around as you go to punch forwards. Now let's switch angles and see what it feels like to rotate the pelvis a little bit more on a set rib cage. So in this position, we're going to use the weight to kind of counterbalance us and hold our rib cage and thoracic spine in place while we move our pelvis and legs in the opposite direction. As I'm going to rotate here towards the left, I'm going to get length through my left internal obliques, and then to come back out of the movement, I'm going to pull out using those left internal obliques concentrically to come back up. We're going to use the wall here to help with some referencing. So I'm going to lay down on my back, and I'm going to have yoga block between my knees, and I'm going to be 90 degrees at my hips and my knees. I'm going to have my toes on the wall, and I'm thinking about using that wall just as reference. So as I go to rotate here, I'm going to think about my knees and my feet moving together as one unit down and one unit coming back out. What I don't want to have happen is to have the knees go here, because that's going to create an arc and torsion through my lumbar spine instead of having my pelvis move together as one unit and end up driving more of that rotation in my thoracic spine. So I'm going to have my weight here. I'm going to reach up and through and towards the midline, feeling this pec major engage as I hug it in, feeling that serratus engage as I punch towards the ceiling and reach through my armpit and pinky. I'm now going to slowly rotate my knees and feet towards the left while I then take my arm back here towards the right, feeling that chest wall open. And then I'm going to push with my left knee, feeling those lower abs flatten as I punch up and come through. So again, we're going to rotate those knees and hips to the left, slow and controlled, let the right shoulder blade slide back, and then push with the left knee to feel those left abs pull up and through. As I'm going to do this movement, to help me not flare my ribs, I can hug my left hand into my left ribs to help kind of block it and push it back. So I'm going to give that little bit of extra pressure to help make sure that I'm not getting some extension instead of rotation, and to help me keep that core connection. You can also place your hand on your lower abs to help make sure when you're coming out of the movement that you're getting a brace and hollowing out versus a pooching out in those lower abs, which is going to indicate more that you're bearing down. We're making sure in our upper body that as we come back here, you're not just bottoming out and hanging out here. So often people will kind of come here first and then go to rotate, but I find it's better to kind of get some of the rotation to happen first and then come back this way. With this chest wall opening up here, we're getting some eccentric lengthening in my right external obliques as well as that pec, feeling that shoulder blade slide back with that arm bone not rolling forwards, and that gives us more power to come up and out and back together to rotate out of it. The last thing to note is that in our hips, we can take a look at those knees. So we talked about not rotating like this. We also want to make sure that we're not leaving this right hip behind. So as I go to rotate, I can almost think about my right pelvis kind of coming up and over the left one, which is sneakily going to encourage a little bit of hip mobility on that left side and set it up for a better place to come back out of it. I find if anyone complains of low back pain or SI joint pain as they're going to do the movement, that it's most likely happening because they're getting kind of a shift or a rotation happening in that pelvis instead of it moving as one unit. So in the end, we should be feeling some great abs working here, some nice chest working, armpit opening here as we lower down, and then feeling that push through and hug in as we come back out. It should leave you feeling with improved rotation afterwards in your mid-back, improved core connection, and feeling like your shoulders just kind of sit back on your rib cage a little bit more easily. Always making sure that we're monitoring that we're not having that bearing down in those lower abs and into that pelvic floor, and that you're maintaining good tension through that midline while we lengthen under load and come back out of it. Did you find this video useful? Make sure to like it and leave a comment to let us know. Check out some of our other helpful YouTube videos and let us know if you have any questions. Want even more? Well, good news. We also have continuing education courses for fitness and movement professionals that you won't want to miss. So check out the description below for more details.